So first of all, hello, welcome to the MiniConference. I hope you can see that I'm not David McCoy, although that's what it says that should be on your program right now. My name's Guddi, and I'm a pediatric doctor, but I'm also the program lead for economic justice at Medact. David had to rush away this afternoon, so he sends apologies for not being here. Now, there are a few people in the audience who weren't present at the AGM this morning, and I wonder whether the people who were there would just excuse me if I just kind of go over a couple of things that David wanted to kind of convey to our Medact supporters more widely. And it's kind of this idea that Medact, as many of you know, is going through this process of regrowth and revitalization, and that process can be quite confusing for a small group like us. And one of the questions that we've been facing, which was alluded to this morning, is this positioning of Medact. We're meant to be a group of progressive health professionals, and we're speaking out on issues beyond healthcare more narrowly. But how do we place ourselves in the wider discourse? You know, should we be within the establishment, and should we be respectable, or should we maybe be a bit more proactive and be a bit more radical? And I think that's something that we're still struggling with. There is a tension, but it's something that I think is part of a wider discussion that we're very open to having, input and feedback from you guys. And so that might be something that you can maybe shed some light on throughout the discussion that we have this afternoon. Now, the real reason that you're here is not to hear about Medact, really, but is to hear from our amazing array of speakers. So Medact is really lucky to be supported by a range of different NGOs and charities that are progressive and are doing amazing work. And so we've got some representatives from a number of them here. Now, the program for this afternoon and the program of the conference is Tax, the Global Economy, and the Politics of Science. Now, that's a very grand sounding title, and one question that many of you may have in your heads is why should health professionals even care about these issues in the first place? And I think thinking about my own kind of path to Medact might be helpful for illustrating the connections for this. So as I said, I'm a pediatric doctor, but it very much struck me through my practice that I wasn't going to be able to help every case of child abuse or malnutrition just by thinking about the pathology that was in front of me, and that it was much more about the societal causes. So we're talking about the social determinants of health, and actually even more than that, the political causes of what brings a patient to you in the clinic room. And I think it's on thinking on those lines and understanding that politics also, and politics and economics are more and more becoming blurred, and they're more and more the same thing. As the financial crisis in 2008 showed, and the Great Recession since then, money really does matter. People are suffering at the hands of economics. And for me, the prime example was the beloved NHS. It had its 66th anniversary earlier this week, and it's undergoing the most severe cuts of its history now, and also is taking steps towards privatisation in the name of economics. It's under an economic argument that this is all happening and it's being allowed to happen. And I think as health professionals, we need to equip ourselves with the knowledge to be able to fight that kind of argument if we know that it's not true. And if that's not enough reason for health professionals to be worried about economics, and I'll give you two other reasons why. It's a growing acceptance now that we are living in a world that is more unequal than it has ever been. And the data on this is clear. And the problem is that economic policies that are being enacted today are going to make that inequality worse in time to come. And so this is not a problem that's going to go away, and this is a problem that is going to affect our patients for many years to come. So that's one. And another reason is climate change. Now, climate change may not, again, seem directly related to health, but Medact likes to think that it is. And the reason is that climate change now is having an effect on the way that people are able to make livelihoods around the world. And it's the poorest people who are going to be affected. And obviously, this will impact on their lives. So again, there's two very good reasons why we as health professionals, if we really care about stopping the reasons why patients come to us in our clinics, this is two reasons why we really should try and get involved in economics. So, economics matters, and Ha-Joon Chang, who's a heterodox economist and one of the leading thinkers in terms of challenging conventional globalism, has said that economics is far too important to leave it to the economists. And that's why we have our speakers here today to tell you why you need to care about economics. So that brings me to the list of speakers, and like I said, we've got an amazing list of people. I'm actually really pleased to say that we not only achieved gender parity on the list, but in fact got more women than men speaking. And in fact, we only want men with the name John speaking, it appears. Well, so let me quickly just say that in terms of the shape of the afternoon, there's three broad sections. We've got two speakers speaking about tax and development and health, and then we'll have a break after a discussion, and then we'll have politics, development and health, and then another break before we talk about science and politics. There will be time for discussion, but what will happen at the end is that we'll have Chris closing the whole conference, and there will be time afterwards for us all to connect if you're able to hang out with us then.